morning, my name is Fabio Bartolozzi. I'm the cardiothoracic surgeon at the Galway Clinic, and today we're going to talk about the journey that the patient goes through before a heart operation. Basically, when somebody has been referred for cardiac surgery for an operation, the patient has already been seen by the cardiologist and there's been already some investigation done, such as the angiogram and normally a cardiac ultrasound. From there, to get ready for the operation itself is very simple. The only thing that we need is a chest X-ray. We do a carotid Doppler, that is simply measuring the flow in the arteries going to the brain, and we do blood tests, and that will get you ready for the operation. Once all those investigations are done and they are reviewed, the patient gets scheduled for the operation itself, and it will come the day before the procedure. Now, when we meet the patient for the first time in the angio day unit, and obviously the procedure will be discussed, and it will be always wise to have a family member in order to have a perfect understanding of the procedure that the patient is going to undergo. Now, at the end of the conversation with the patient and the family member, obviously we are open to answer any question that the patient has, and more important, they will give the patient and the family member a card with a phone number that they can call or they can access anytime, because normally it's too many information to take on the first time that we meet, and when everybody goes home is full of questions, and at the right time to write them down, and if they want they can give us a call and we'll be happy to answer those questions. As mentioned before, the patient comes to the Galway Clinic just the day before the operation, and normally in the afternoon, and it will undergo some blood test, that is routine blood test and group and cross match, just to be ready for the procedure itself. And then I'll see the patient and we go through the procedure again, and then at the end of our meeting, obviously we'll sign the consent form. The patient will be seen by the anesthetist as well, so if there is any question that needs to be asked or anything that needs to be told to the anesthetist, that's the right time to do so. Now, the morning of the operation we like to start early, so the patient will be going to theatre around 7 o'clock, and after the routine check that we do to make sure that it's the right patient going to theatre, the patient will be attended by the anesthetist. Once the anesthetist has done all the procedure to get the patient ready for the operation, we move into the operating room. The average length of an operation, either bypass or a valve, is about 3 hours, 3.5 hours. And after the operation, we always make sure that the family member gets informed that the operation is finished, even before the patient goes back to the intensive care unit.